Good evening, everyone. Can you hear me okay?
Yes, Erica, we can hear you. Thank you. I would like to introduce everybody to Erica Gutenbach, who will be moderating today. Thank you.
Good evening, everyone. Apologies for the technical difficulties we're experiencing tonight. We're all learning and growing together in this new virtual age, and thank you for your patience with us. So welcome to the Whatcom County COVID-19 Vaccination Update Town Hall. So for folks using our closed captioning, that is an option tonight. There is the availability to have subtitles and live captions in English and Spanish. And to do that, you can go to captions/subtitles. To change the caption language, select Settings, Captions/subtitles, and choose the language you want. And ASL interpretation will be provided in a separate GoToMeet event. So first we'll start with introductions, and then we'll move on to some big questions about vaccine supply and demand. And then I will provide a vaccine status report for Whatcom County, and our vaccine providers will provide updates, including Peace Health, CMAR, Family Care Network, and Unity Care Northwest. And we will also share some information about large-scale community vaccine planning. I'm hopeful that we can have our vaccine provider updates first, and I will work on my technology and provide the update on the big questions following those updates.
Great. Again, I apologize for all this technical difficulty, but this is Jim Boxler from Peace Health Medical Group, and I want to give everyone an update on what we at Peace Health have been doing in terms of COVID-19 vaccinations. We have had two separate programs that both have vaccinated quite a number of our community members. First was a program through St. Joseph Hospital that vaccinated Peace Health caregivers and providers in the community who are part of our medical staff. Through that program, we have currently given out 6,303 vaccines, 3,508 first doses, and 2,795 second dose vaccines. We also have been participating in vaccinating other community partners who are 1A healthcare workers, first responders, people working in the skilled nursing facilities, and other community providers in Whatcom County. Through that, we have vaccinated at least 1,200 community members at our Peace Health Medical Group clinics, and are starting second doses with that now. We have about 1,000 more 1A healthcare providers on our list that we're contacting and trying to get scheduled when we have doses available. We also have been giving vaccines to the 65 and older population that was approved by our governor a couple of weeks ago. We had borrowed vaccines from other community members for our 1A and for the start of this process, and we've given out about 2,000 doses to people 65 and older in our community as well. In addition to this, we are working closely with Whatcom Unified Incident Command to set up vaccine clinics for everyone else. We currently are making plans to be able to reach out to anyone that we have a record of and can ascertain that they are within the governor's age group and tiering for prioritization. And when we receive vaccines, we will be contacting those patients and setting up a ticket system for our vaccine clinic. Can you go to the next slide, Joanna? So as you'll hear from everyone, we currently do not have nearly enough vaccine to meet the demand that we're getting from our Peace Health Medical Group patients, from our Peace Health overall patients, or for our community. We are trying to get ways to make sure that we reach out to those who are most vulnerable and are prepared to do that when we get vaccines available. We are going to be using our web portal and also some other methods of touching base with patients as we get vaccines available. We do not want to schedule patients when we don't have vaccines available. I think you'll hear that from all of the providers. So we understand that there's been a lot of demand, that we have not been able to meet that demand. We have done our best to try and equitably get the vaccine out to those who are most in need of it, and plan on continuing that. I think next is Ione Adams on a report from CMAR Clinic.
This is Ione Adams. I'm the medical director at the CMAR Clinic, and our story is similar to that you are hearing from other community members. We have two clinics in Whatcom County, as many people are probably aware, our larger clinic in Bellingham and our satellite clinic in Everson. Interestingly enough, both sites enrolled at the same time. And to date, only the Everson Clinic has received vaccine shipments. The Bellingham Clinic has been approved, but we are still anxiously awaiting receipt of any vaccines. So at this point in time, we've received 1,500 doses and 1,400 doses have been administered. The remaining 100 are being administered as second doses for certain individuals who have received their first dose. We reached out to the community for phase 1A folks and were able to vaccinate many dental, physical therapy, and other medical colleagues in the community who were in need of vaccination. We also in our population have a lot of essential workers that we are ready to reach out to, as well as our farm workers as soon as they are available. It's our commitment to help provide vaccine to the wide community as well as to CMAR patients. Currently, the CMAR website is updated daily. Unfortunately, if you look today, none of the CMAR clinics in Western Washington have vaccine available. We will also be notifying patients through our patient portal. We will be making phone calls. We have promotoras that work in the community and other colleagues in the community who will be notifying folks and as soon as we have vaccine available. Thank you.
Thank you, Dr. Adams. Appreciate that update. This is Erica Lautenbach, and I'm back, and hopefully for good back. So we'll continue on, and then I'll share some information about vaccine. I want to next turn it over to Dr. Rodney Anderson, who's the president and CEO of Family Care Network, for an update on your perspective and what you're seeing.
Great, thanks, Erica. Thank Whatcom County Health Department for putting this on, and for everybody listening in. I just want to step back and share first this graphic images, maybe a graphic representation of my emotional state, and I suspect many others' emotional state over the last year or so. It's interesting to think that we're quickly coming up on 1 year since COVID really hit in the community, and obviously it was a difficult year most of last year. And then I think, as many of you know, these two vaccines that we now have available were approved in early mid-December, which I think was met both by patients and by the healthcare community with a huge sense of optimism. We as healthcare providers go into this because our strong desire is to take care of human beings, and so to face a life-threatening pandemic and not really have any tools to help patients certainly not to create the immunity that's needed was certainly a difficult ride for all of us. Since the vaccines came out, obviously the rollout has not gone as any of us have planned. And I think we would just acknowledge across the board the frustration, anger, disappointment. I've certainly heard that from patients. I know many healthcare providers certainly feel like they're letting down the patients that we serve because we don't have the vaccines available. So, you know, this has been obviously a monumental task for the government and many healthcare organizations across the entire United States, but I certainly hope that things will improve moving forward. So next slide. So in terms of some kind of numbers around eligible patients and doses that Family Care Network has received, Family Care Network, as many of you may know, only provides primary care services, predominantly in Whatcom County with some presence down in Skagit County. We have at least 25,000 eligible patients. Those are patients over the age of 65. Again, the vast majority of those would be in Whatcom County. We don't have a good way from our system to pull out patients who are frontline healthcare providers, nor those who are over age 50 but live in a household with older adults. So again, at least 25,000. As you can see, to date, we've received 1,400 doses, which is extremely disappointing for all of us. We, like these other organizations, immediately targeted frontline healthcare workers and first responders, so have administered or have scheduled 900 first and second doses for healthcare workers and frontline responders. And again, that leaves about a total of 500 doses is what we've had to administer. So, numerically, that's less than 2% of our eligible population, which has been challenging for us. In terms of enrolled sites, we tried to enroll 14 sites on December 6th when applications were first allowed to be submitted, and 9 have been approved and 5 are still pending. Why it has taken more than 2 months to approve these sites is frankly a bit confusing to me, but we continue to try to chip away at that. And then just to frame, each week, each of us organizations have the opportunity to order doses. And so to kind of frame over the last few weeks, how many doses have been ordered versus those received, Family Care Network several weeks ago ordered 3,000 doses, received 100. I believe it was last week, or requested 4,000 doses, received 0. For this week, requested 2,000 doses and have yet to receive any doses. So that's obviously been challenging. We did in mid-December ramp up or start plans to ramp up to be able to administer somewhere in the range of 2,500 to 3,000 doses a week. That is administering doses through all 10 of our outpatient clinics, as well as propping up a drive-through site in Bellingham. And we actually opened the drive-through site yesterday because we had some doses to administer, but we only had enough to run yesterday. And so that was simultaneously exciting for us to be able to open that and extremely disappointing to now have to pause it because we have no other doses to administer. Next slide. So information about this, the best source for Family Care Network patients is to go to our website, familycarenetwork.com. We have spent a large amount of resources trying to keep this information up to date. And I think, as we all know, this is changing almost daily, it seems. And so our website is kind of the primary source. And if you log in, that yellow banner that you can see across the top has information about COVID testing, and COVID vaccines. When a vaccine does become available, scheduling will be done both online and via a central phone center. And then we are developing a plan to have a standard predetermined time when vaccine appointments will be open so that patients don't have confusion about that. And in terms of eligibility, I think like everybody else, we are following the state recommendations. If you are not aware, you can check your eligibility at the website findyourphasewa.org, fill out a simple survey, and it will tell you whether you are eligible or not. Thank you.
Thank you, Dr. Anderson. And last but not least, Shannon Hardy, who's the Chief Operating Officer of Unity Care Northwest, is going to talk about Unity Care, but also an exciting project that we're working on as a community together. So go ahead, Shannon.
Yes, hi everybody. Can you hear me okay? I had to call in because there was a problem with the technology.
We can hear you, yes.
Okay, great, wonderful. So my name is Shannon Hardy, and I'm the Chief Operating Officer for Unity Care Northwest. And so first I'll give you an update on our progress so far. In terms of our employees, the majority of our phase 1 staff have now received their first doses, with their second doses being scheduled to be completed by the end of February. In terms of our patients, Our Bellingham and North Whatcom Health Centers are both now approved as vaccine providers. Our Bellingham location received our first shipment of vaccines last week. And while we ordered 3,550 doses, we only received 200. And all were administered to eligible Phase 1A healthcare workers and 1B patients. We did not receive any vaccine allocations this week, and so we're looking forward to finding out tomorrow whether or not we'll receive any for next week. Certainly when we get our next allotment of vaccines, our priorities are going to be to assist with community Phase 1A healthcare workers, as there's still many in our community that have not been vaccinated, and we'll also continue with our eligible Phase 1B patients. We've estimated that we have around 3,000 patients that are age 65 and over. We want to just kind of assure our patients that we will reach out to you as vaccines become available and you fall within the eligible phases. And we're committed to employing an equitable process for access based upon Washington Department of Health guidelines. So that kind of wraps up my update for Unity Care. And so I will move on to the large-scale community vaccination efforts. So in addition to the individual efforts you've heard from the providers tonight and some of our pharmacy organizations that are making to vaccinate their own employees and patients, I'm really pleased to announce that a collaborative partnership has been formed between Unity Care Northwest, Peace Health, CMAR, Family Care Network, and the Whatcom County Health Department to plan for and stand up community large-scale vaccination program. We really want to make sure that all Whatcom County residents have access and an opportunity to get vaccinated. So together, we are working closely on our shared objectives of timely, equitable, and accessible vaccines. Our goal is to identify and implement solutions that get us to administering 5,000 or more vaccinations per week, following the CDC's phase guidelines. Our steering committee for this is being led by Laura Welker and myself, with representation from each partner organization. So we've been underway now for a couple of weeks, and our planning work groups are making really great progress. And one of our successes is the addition of the Bellingham Technical College and Whatcom Community College's nursing programs to our partnership and planning process. So we're excited to have them on board now as well. We're targeting March to kind of begin our operations, but I just need to kind of caution everyone that much of that will be dependent on the resolution of the supply chain challenges. It's super important that our efforts increase and enhance community access to vaccinations and not divert or compete with existing vaccination efforts. I really want to take a moment to thank Peace Health for their innovation and their willingness to show, tell, and share their best practices, which is really helping us advance our planning more quickly than otherwise possible. And it's really important to also thank the Whatcom County Health Department for serving as the foundational hub for this unified approach and for their leadership and advocating with the state on our county's behalf. So we will continue to keep the community updated and informed as plans progress and specific details are available. Just want to make sure that everyone knows that helping our community get to the other side of this pandemic and its devastating impacts to our physical, mental, and economic health and well-being is our top and often only priority right now. Taking care of our community is our North Star, and this is the most important work of our lifetime, and we're really excited to have this collaborative partnership to help advance better access to vaccines in our community. So thank you very much. Pass it back to you, Erica.
Thank you, Shannon. Thank you so much, Shannon. And Joanna, if you could go back to slide 5, that would be great. Thank you. So I want to reflect for a moment on what we've heard for the last 20 minutes or so, and really just a wonderful mix of hope and optimism from our providers. I want to express my gratitude to all of our enrolled providers, not just those that are here, especially those that are here but to all of our enrolled providers for sharing and embracing our community goal of vaccinating everyone who wants a vaccine as soon as possible. I am amazed and impressed by how quickly our providers have ramped up, how quickly they've changed systems to ensure and adding staffing to ensure that they can not only see patients in the clinic for day-to-day needs, but they are also able to ramp up in areas so they can also vaccinate both patients and non-patients alike. And it's just really encouraging to hear from all of you. And on the flip side, I think we all share and recognize the challenges in sharing frustration and the challenges associated with vaccine supply. And I'll talk a little bit more about that as well in just a couple of moments. But first, I want to just kind of go back to that big high-level overview, which is where we currently sit in Whatcom County. First, we know that tens of thousands of currently eligible Whatcom County residents are ready and waiting and willing to be vaccinated. We estimate at the health department there's somewhere around 60,000 people that meet the current criteria for eligibility. That includes the healthcare workers and first responders. It includes long-term care facility staff and residents, everyone ages 65 and over, and those age 50 and older living in multi-generational households. We also know, and currently as of this week, we have 34 enrolled provider sites in Whatcom County ready and willing to vaccinate. Vaccine represents hope and signals the end of this pandemic, and we appreciate the partnership of our providers who will help us get there. That said, and I will once again share, as many of the providers did, that our community as a whole, between all of those 34 providers, those that were given vaccine this week, we received a total of 700 doses. We know that's not nearly enough to get us where we need to go and to make sure that we can vaccinate folks. Next slide, please, Joanna. And I want to share, we've heard a lot at the health department, and I know our providers have as well. The words we hear more often than anything from our callers and those that email us are vaccine, vaccine, vaccine. We know it's frustrating. We're all frustrated by the lack of supply in our community. And I do want to share that earlier this week, our Whatcom County Health Board, which is also our county council, sent a letter to the State Department of Health asking for some transparency and clarity around how vaccines are allocated. More specifically, we are unclear how allocation decisions across the state are being made. We are unclear from week to week how much supply Whatcom County will receive. We are unclear which providers will get the vaccine from week to week. And we are unclear from week to week how many doses each provider will receive. As you can probably recognize, for a provider to receive 1,000 doses one week and then 0 the next week makes planning, staffing, scheduling nearly impossible. And we really want to provide our enrolled providers with some consistency, some reliability, and some ability to plan so we can make sure that we're doing the best we can to get folks vaccinated in our community. And I'm hopeful that we'll learn more details from the State Department of Health, and we will hear back from them with some of these specifics so we can provide answers both to our providers and to all of our residents who are asking these questions as well and really not clear about what the process is. So as you heard from our providers, and if you talk to other providers in our community, which include pharmacies and smaller clinics and others, we have a vaccine system built to deliver vaccine to Whatcom County residents through multiple access points. We are lucky in Whatcom County to have so many providers step up and want to provide vaccine and want to be part of that solution. What we don't have is vaccine. And that's hopefully that's very clear to everyone who's listening or viewing tonight's call. That is our challenge. So next slide, Joanna. For more information, and I'm going to read this for our listeners tonight. For more information, The website of providers participating today, they shared that they have information that they update very regularly on their websites. You can go to your healthcare provider's website as well for more information. Many of our clinics and other providers are also updating their websites. You can go to the Whatcom County Health Department. We have regular updates as well from a broader perspective, since we are sort of the liaison to the State Department of Health on some of these unanswered questions. And our website for vaccines specifically is www.whatcomcounty.us/COVID vaccine. And lastly, the Washington State Department of Health has a COVIDvaccinewa.org site, which is also, it doubles as a phase finder. So if you're unclear about which phase you fall into, or if you're eligible for vaccine, you can go onto that site. And it also has vaccine locations. So I want to just share this final slide, and then we'll move to some of the questions we've received. This is a roll-up of where we are in Whatcom County. And for those of you listening, we will be providing this weekly on our Facebook page and on our on the Whatcom County Health Department website. But what this tells us is where we are in terms of our whole community. We have at this point 16,536 residents of Whatcom County that have received their first dose. That's about just over 7% of our population. And 3,891 residents are fully vaccinated in Whatcom County, and that's about 1.72% of our residents. Our providers have given out 16,360 vaccines thus far, and our community has received 14,550 first dose allocations. We will be providing updates on that weekly as well. So I want to go ahead and move on to some of the questions we received. There are some themes and certainly some frequently asked questions, and let's just dive in. I'll start answering the first question, but I want to allow our other panelists to answer some of the other pressing questions that we've received. So the first question, and we do hear about this a lot because those who are eligible to receive vaccine want to know where they can do that. The question is, why do you not list every enrolled provider and how many doses they receive? So each enrolled provider must give consent to the State Department of Health before they can list them on their provider page. Similarly, it is up to each provider to decide what information they want to release about the number of doses they have each week. So that phase finder that I referenced is not always going to have every enrolled provider on that list, depending on availability of vaccine and supply of vaccine. And I also want to share that the number of doses is not always a good indicator of what's available in the community. So for example, let's say a provider receives 100 doses in a given week. For someone who is looking for vaccine, they might think that there are 100 available appointments, but perhaps that provider has already partnered with an adult family home or home health care providers who are highest priority individuals to receive the vaccine, and they've partnered with them that week to give out vaccine and make sure that those folks get their first dose. So what looks like 100 available doses may only be 20, or it may not be any available doses. So that's just something to keep in mind, that there are still efforts to make sure that our highest priority individuals are receiving that vaccine. So the second question is, and I want to offer this up to our providers to share a bit of insight and information on, is which providers offer the vaccine to anyone, even if they aren't a patient, and how are providers prioritizing who to give vaccine to? I'm going to go ahead and ask Dr. Adams to start us off, if you would, please.
CMAR is committed to being an active participant in vaccinating the community at large. When we received some of our initial vaccines at our Everson clinic, we did have open vaccination time where people could come, and it was on a first come, first served basis, as long as you were in the qualifying group according to the state priorities. Our goal is to continue to help in that effort as well, potentially at our clinics, as well as at the mass vaccination sites. And we'll also be reaching out to our patient population as they qualify. So at the risk of beating a drum that we've heard all throughout this call, it really will depend upon when we have vaccine available, and if there is the opportunity to open it up to a community at large based on receipt of vaccine, that will be posted on our website. And we do invite people to come and get their shots when and if we have them. Thank you.
Thank you, Dr. Adams. Dr. Boxler, I know that you've been working on this, and you were one of our first providers to reach out to non-patients to provide vaccine. So could you share a little bit about what Peace Health is doing to share vaccine with non-patients?
Sure, I mentioned this already earlier, but for the 1A group, we were open for any healthcare provider or anybody else who is in the 1A group. We still are working on finishing that group of people who've reached out to us. As we get to the broader population, we are committed to vaccinating everybody, making sure that everyone in the community gets vaccinated. We're doing that through a couple of ways. We know from our data that we've been able to look at that close to 70% of the 65 and older population has been in contact with Peace Health in some way over the last year, and we plan on reaching out to them and are trying to figure out the best and safest way to prioritize that group, because it's actually about 35 to 37,000 patients. And we are now looking at prioritizing certain groups, such as our oncology patients undergoing active therapy, regardless of where they get their primary care. And we are going to start using an age-rated system within the priorities so that we can get the most vulnerable patients first. We also are working with community partners to do outreach to patient groups that might be more difficult to reach, such as those who are not English speaking, and we are committed to having our vaccine clinic open to those communities as well as we move forward.
Thank you, Dr. Boxler. Shannon or Dr. Anderson, would you like to contribute to this question as well?
Sure, this is Rodney Anderson. I'd be happy to chime in. When Family Care Network first received kind of some of their early doses, we also held several clinics reaching out to community healthcare providers and first responders. And so we are cycling through second doses of those providers as well. The challenge for us at this point, obviously, has been, we serve about 50% of the county population in terms of providing primary care services. But, as best I can tell, we've received maybe 8 or 9% of the doses that have come into the county. And so our focus is very much sort of shifted to vaccinating our own patients. We would love to do our part to vaccinate the broader community, but obviously we have a large number of patients that we have longstanding relationships with. They would be our top priority. If supply obviously exceeds the number of eligible patients we have, we would be more than happy to contribute to broader community vaccination effort. In terms of prioritizing patients, obviously it all hinges on the number of doses, the supply that we have. So that is kind of a continually moving target. And as has been said many times, the challenge is just the limited supply.
Great.
So this is
Thank
Shannon,
you.
and I can add it. Unity Care. We have, as I mentioned earlier, about 3,000 patients that are age 65 and older. Our total patient population is right around 22,000 patients. We serve about 1 in 10 residents of Whatcom County. And we're using age and diagnosis right now so we can ensure our most vulnerable patients are contacted first. We are also trying to be part of the solution for 1A healthcare workers. Now that we're starting to get vaccines, like I said, we had 1 week we got them, and then we haven't gotten any this week. So there's still quite a few other healthcare providers out there, dentists and dental offices, physical therapists, home health workers that are also in need. And so we want to be part of that solution as well. But like the drumbeat keeps being sounded, it's the vaccine supply that's a big issue. We do hope that the large-scale community vaccination efforts about earlier will be a better solution or a good solution for folks that fall outside of our patient groups as we're able to stand those up with more vaccine coming.
Great, thanks for that. Yes, that is certainly one of the goals of the large-scale community vaccination site. I also want to share that pharmacies are also enrolled providers. So pharmacies like Safeway, Hagen, and Costco are enrolled providers, and they're taking appointments as they have vaccine available. And they, of course, can vaccinate folks who don't have an affiliation with a specific provider as well. So there's a number of options available to people who may not have a provider group or a provider. So the next question, I think we might have time for two more. The next question is, how does the process for second doses work? Can I go to a different provider for my second dose? And how are providers planning for second doses? A lot of questions about those. So Dr. Boxer, we'd love to hear a bit more information about how that's working.
Yeah, happy to answer that question. We are getting a lot of second dose people through our clinics now. One thing to keep in mind for everyone out there is that it is it's really much better if you can get back to the same place that you got your first dose for your second dose. And that is because the supply of vaccines for the second dose are sent to coincide with that second dose after you've gotten the first dose. It's also really important for people to make sure that they get the same vaccine for their second dose. Whether there's two out there, it is important to make sure that you get, if you get started with Moderna, that your second dose is with Moderna. And if you've started with Pfizer, your second dose is with Pfizer. We do not have data on mixing the vaccines, and we are doing our very, very best to not mix vaccines. What we are doing to ensure that people get in for their second dose, in addition to trusting the supply chain, which this part of it has been trustworthy for us so far, is as people are getting their first dose, we are scheduling for their second dose. For Pfizer, that time is between 17 days and 25 days optimally. 21 days is what the testing was done on. But there's a 4-day window on either side that the CDC gives us. And for Moderna, which is a 28 days between the two doses, it's between 24 and 32 days that we're trying to get those scheduled. So we're getting everybody scheduled as they're getting their first dose so that they know when to come in for their second dose. And we have so far been getting those second doses arriving at the right time for those appointments. So far we've been successful, but we have gotten a lot of people asking when they've gotten a vaccine elsewhere if they can come to us for getting their second dose vaccine, but we are not receiving their second dose vaccine. So we haven't been able to say yes for that yet.
Thanks, that's really helpful. I know it really clears things up about the process and the timing and all of that. Thank you for that explanation. I was remiss because I mentioned in the last answer that I mentioned Safeway, Hagen, and Costco by name, but there are also lots of small pharmacies that are smaller pharmacies, not the chain pharmacies, that are receiving vaccine as well. So it's not just those three, but there's a number of different pharmacies that are also receiving vaccine. So I just want to share that. Moving on, how are you ensuring equitable access to the vaccine, including access for people who face barriers to getting to a clinic or people of color? So first of all, in terms of prioritizing vaccine phases, those decisions that are made at they're not decisions that were made at the local level. The State Department of Health had a community engagement process and criteria for selecting priority groups. And for more information about that, you can go to that www.covidvaccinelaw.org site as well. So we in the community, public health professionals and our health professionals recognize that age, race, socioeconomic status, and language barriers are critical determinants of health and significantly factor into COVID-19 as well. The health department, if we receive requested vaccine next week, we will start a small pilot with a mobile vaccine clinic at adult family homes. Our intention is that this mobile clinic model will be used to serve other vulnerable populations, and we can certainly share more information about the details soon. But right now, we're still developing that data-driven criteria that will guide us in making equitable decisions about where the mobile clinic will go. We are also, as a health department, developing partnerships and outreach strategies with local organizations that serve people in future phases of 1B who will face access issues. Their input will be part of our planning to give everyone their chance to get vaccinated. No one who wants to get a vaccine will be left behind. And if others have anything else they'd like to share about that question, we have about 30 seconds left. Okay.
Yeah, Erica, I can add something to that too. I would just say that in our effort for the community-wide effort, we are also looking at things like, trying to identify a location that's on the good bus route. So there's easy transportation access via bus. We're looking at making sure that our hours for vaccine clinics extend quite broadly. So we have evening hours, weekend hours, daytime hours. So we are looking at a number of different criteria to assure that we have access for, all kinds of our residents of Whatcom County, that whether they're working, whether they have transportation issues. We'll be looking at things like language barriers and what we can do to provide access and services on site for that. So there's a number of things that we will be doing to try to make sure that we can promote equitable access by our whole community.
Great. Thanks so much for adding that. I think that's really helpful for folks to hear that this large-scale vaccination site will really also be focused on equitable access for vaccination for our whole community. So with that, I want to just thank our panelists, Dr. Boxler, Dr. Adams, Dr. Anderson, and Shannon. Thanks so much for joining me. I think this has been really helpful for me to learn from you, and I hope that those watching and listening have also gotten some helpful information and a better understanding of how well and poised our community is to get folks vaccinated as soon as we have supply. So with that, thank you again. Thanks for joining us. We appreciate your time this evening, and be well.